Demands for reconstruction are purely cosmetic is what we can think of. The patient wants a good contour, bilateral symmetry, and then we can divide it into oncoplasty, partial breast reconstructions, and whole breast reconstructions. Now, because of the earlier detections and breast conservation surgeries, what we do in breast oncoplasties would be that the diseased breast would be recontoured, and at the same time the opposite breast reduction mammoplasty is usually done when the tumor excisions are a little big. And in the diseased breast, oncoplastic principles would be required to give a better contour, and opposite breast needs to be, the normal breast needs to be readjusted to match the shape of the diseased breast. So what is by definition oncoplasty? It's a little bit of a misnomer. It just means onco meaning cancer and plasty meaning basically plastic surgical principles. Nowhere breast comes in between, but this term has now been exclusively being used for breast conservation surgeries wherein plastic surgical principles are required and which are dealt with by that. So this is what I could find the best definition of a breast oncoplasty in text. Now coming on to oncoplasty in general, there are basically two components of breast oncoplasty as has been described in various papers. One is by Krishna Klau. Now one is volume displacement and the other one is volume replacement. So as they are self-explanatory terms, a volume displacement would mean the already existing part of the breast is recontoured and readjusted in a manner so that it gives a good shape to the breast. So this is obviously, it entails two parts. That is, one is the nipple areola complex has to be in the correct position, and also sometimes because of the tumor excision it is not possible to just give nipple areola its normal, to assign it to the normal place. So we need to use the reduction mammoplasty principles. So this is what would be coming in volume displacement methods. Volume replacement obviously means that too much of breast has been removed percentage wise, and so it is not possible to reconstruct using the local tissue. Then a latissimus dorsi, tram or DIP flap etc. can be used, whatever soft tissue flaps we think of.